Nurses, doctors, hospital workers of Reddit. What's your creepiest experience in a hospital? Serious. I work as an ICU nurse. A mid-20s female came in with some serious cardiac abnormalities and then went into respiratory distress. Never had any medical history at all. We had to put her on the ventilator, but she was on just enough sedation to keep her lucid. She could not shake her head yes and no appropriately to questions. One night, the patient in the room next to hers died, but the body was still in the room about to be taken to the morgue. The female patient's door was closed with curtains drawn, so she couldn't have seen what was going on next door. When I went in to check on her, she had a look of sheer panic on her face, trembling. I asked her a series of questions to see if she was cold, hot, in pain etc. and she denied all. I asked her if she saw something. She started to aggressively nod her head yes. She wasn't on any drugs that would make her hallucinate. I went on to get details on what this thing looked like. After playing 20 questions I got this. A man, pale white, left arm missing, heavy, bald, standing still, behind me. This was the man who had just died next door. I spent the rest of the night consoling her. I would have needed a change of pants. That's ridiculous. I work and dispatch in the basement of the hospital. I was working the night shift and I was alone. I had the door closed, and there is a key code needed to unlock the door. I am the only one in my corridor of the basement at this time. I heard over the intercom that there was a code yellow, missing patient, from the mental health floor. I have no idea how he got out, but now he was roaming the hospital. About 10 minutes later, the door handle starts shaking and someone is trying to get in. I stayed completely silent until it stopped, then got up and looked through the peephole. There was a man just sitting against the wall wearing a hospital gown. I went back to my desk and called security, and I spoke as quietly as I could so he wouldn't hear and run away. Security came and I heard them take him away. He was yelling all sorts of stuff that didn't make sense and was clearly resisting them. A guard came in afterwards and asked if I was okay and I told him I was fine thanks to the door lock. Thank you. Keypad. I work at an architecture firm and we had a lunch and learned today about electronic access controls. Your story would have been fun to share had I read it before lunch. Context. Lack of room in the hospital. Some rooms sadly must have 2 patients. Frontal syndrome patient, due to metastasis of lung cancer. Laugh while we announce the high probability of lung cancer to his hospital roommate. For your information, frontal syndrome is in reference to your frontal lobe. It will seriously frick up nearly everything about it. Inappropriate emotional reactions is one of many symptoms. My mom works as a nurse in the ICU and she always says that the patients know when it is their time. They usually say nandito na sila o their alri here in Filipino. They also usually ask for a glass of water and just flatline right before it was given to them. Most patients, days before they die, say that they can see a black figure in the corner of their room. Scary crap. My mom usually experiences not less than 2 deaths a week, whether her patient or not. I can't imagine the stress she goes through, and I admire her strength for that. When my dad was actively dying he would talk about seeing loved ones in front of him. I had to sleep in the same room with him at night for a couple of weeks BC. My mom had to go on a trip. I barely slept a wink those couple of weeks. All I kept thinking was the Grim Reaper in the shadows alongside dead loved ones. On my way to the morgue with a colleague, pushing a bed with a recently deceased man. My first time going down there, so I was a little bit creeped out, but it was with a kind of cute colleague, so I kept my cool. We leave the body in the cold storage room. She goes out while I handle the paperwork and I shortly follow and reach to close the door behind me. After that follows one of the most terrifying screeches I have ever heard from the room behind me. I lose my crap, jump about 2 meters in the air and let out a loud screech. Turns out the door screeches when closing, but not when opening. My colleague was laughing her butt off. I think any noise in a morgue would scare the crap out of me. Little off, but I worked as a kitchen aide in a nursing home. Got plenty of interaction with the residents. I was cleaning one of the dining rooms. There was still 1 woman present. One of the CNAs came into the dining room and asked if the resident was ready to go. Mind you, this woman has been here for over 6 months. Always incredibly nice, nothing short of a gem. The resident grabs the CNA by her collar and says, With the biggest smile, "I will slit your freaking throat," and just gently pushes her away. The endearing smile and look of pure joy never left her face. She was quickly moved to the dementia unit. She just really loved that lime jello and didn't want to leave yet. Not exactly creepy per se, but I freaked out big time. I work in an animal hospital. We had just euthanized an animal someone had dropped off. A black lab named Chloe. I got her all bagged up and moved her to the freezer to be picked up later. Went to see the next patient after I was done there. Grabbed the chart off the door and looked at her name and history. It was Chloe. Okay, weird coincidence. Looked at her breed. Black lab. Cue me freaking out in my head thinking the wrong dog had been euthanized by some freak mistake. Went and reviewed the records to be sure a mistake hadn't been made. Luckily we hadn't. Just 2 labs named Chloe in our clinic. One of the worst internal freakouts I've ever had. I got worried for a moment. Glad things turned out better than it could have. Power outage caused a cascade failure of all 3 generators and the entire floor I worked on went pitch black. No battery pack lighting. Just the confused groans of the patients waiting outside radiology and the crying of someone's baby. Sounds like the prologue to a horror game, just before the disease makes itself known. I'm a nurse in a retirement home. I have quite a few stories. Most of them are hilarious and then there are those you never want to think about. What fricked me up the most was when I saw how eyes change at the moment of death. Imagine you are looking at clear water but that clear water changes to foggy in an instant. In my 8 years here I've only seen this once. And I've personally saw well over 250 dead or dying people. UK psychiatrist here. I've had a number of unnerving incidents over the years, of which a few stand out. 1. Working in a community memory clinic. I go to do a home visit to assess a patient who had been referred to us. Man in his 70s. Some kind of chronic lung disease. I forget what. Probably COPD, which meant he was on oxygen at home. He was more or less with it, only mild dementia, and the assessment was going pretty well. I was copying down a list of his current medications from a pile of prescription sheets, when suddenly I can smell smoke. I look up, and the guy is calmly smoking a cigarette, seemingly unconcerned about the fact that the cigarette is only a couple of inches away from his nasal oxygen tubes. Trying not to sound panicked, I ask him to please put out the cigarette, which he obligingly does, by stubbing it out on the fricking oxygen tank. 2. Child psych. Extremely anxious teenage girl with recurrent sleep paralysis. She reported waking up in the middle of the night, unable to move, and being aware of several shadowy figures in her room, clustered around her bed and staring at her. This had been going on for a few weeks, and just prior to her being referred to us, she had started seeing the shadow people when she was awake, always watching her from somewhere in her peripheral vision. 3. Child psych. Again. 5-year-old girl with some variation on a theme of high-functioning autism, who I was doing a neurodevelopmentally assessment on. During the appointment, she began telling me a story about how she had been playing in the woods. She got lost and the shining people had found her and hidden her in the place under the hill. Her parents had gone looking for her, and the shining people had made a doll out of sticks and leaves which they gave to her parents, and made them think was her. There was something incredibly creepy about the way that she told the story, particularly when I, playing along to see where this was going, asked her how she escaped, and she looked me straight in the eyes, for the only time in the entire appointment, and said I didn't. 4. High security psychiatric unit. On a night shift around 4 AM. We had a policy that the on-call doctor had to do twice nightly visual checks on all the patients in seclusion rooms. Each door had an observation window, which had a cover on the outside that could be slid open to look into the room. Slid the hatch open on one room, to find myself face to face with the patient, who was standing motionless, eyes unblinking, his face pressed up against the glass. We have a room on my floor that is known by staff to jokingly be haunted. I have had numerous patients in that room see things come from the ceiling and materialize in the room with them. Sometimes our staff attributes these to the hallucinations, but I was taking with a guy who was totally with it and he saw the same crap. To add further credit to this, a staff member's father was staying in that room and my co-worker joked, "Dad, you got the haunted room," and not 10 minutes later the picture on the wall lifted off the backing wire and fell to the floor. My personal experience in there is that the pulse oxygen monitor and EKG start reading when no one is hooked up in room. The room always gives me goosebumps. Dude, your machines are giving false positives. Get that fixed. This one chap was decidedly equine below the belt. He probably exposed himself on purpose while in the hospital bed. Drawing back his gown, there was an endless trooping of persons on staff quietly in and out of his room, until the RN supervisor put an end to it. Slow work days are like slow news days, maybe. I was an X-ray tech for years. At one point, I worked the night shift and I worked alone. One night I had to X-ray a homeless man who had hurt his shoulder or something. Anyway, I had rolled him into the room and parked him against the door opposite where the control panel was. I got some film and was walking back into the room towards the man and he looked at me and said, "It's like watching an aquarium. You're surrounded." He went on to say I was surrounded by people and animals and that I was also being watched by people from some native tribe I had never heard of, and told me I should feel honored since they didn't follow just anyone. It was like 5 AM and this freaked me the frick out. For the only time in my life I actually had that cold icy feeling going down my spine. I know he was probably suffering from some mental issue, but isn't that just the type of person who does this? Weirdly, a year or so later when I was visiting San Francisco, I had a fortune teller stop me on the street and ask to do my reading. She said the same thing, that I was surrounded. I worked for a year as a storekeeper in the pediatric ward. One day, in the corridor outside the operating theaters, I hear this loud, echoing sound. Ping. 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 I walk down to try and figure out what it is, and I look into the orthopedic room, and I see a surgeon with a steel hammer and a chisel hammering a hip, as if it was a rail spike. Big overhand hammer swings. Ping. 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 Ortho are basically the mechanics of the hospital. They can be insanely rough on patients sometimes. I wasn't a nurse at the time, but a PTC in an emergency room. I went into a room where a patient was sedated and intubated after a code I wasn't present for. I was detaching some monitors and putting on portables when transport came to get the patient. I had my back turned talking to him for a minute, and he suddenly gasped. I turned around and the patient was lurching up from the bed, fighting the tube, and reaching out for me. I quickly laid her back on the bed and was telling her to calm down. Don't try to fight it. It's okay that you can't talk, etc, etc. I'm glad I didn't just smack her because that was my initial, startled thought. It can happen with sedated patients, but it was my first experience with it and it certainly threw me off my game. It's so funny how you learn to override your automatic reactions when you work in healthcare. I remember the first time a patient punched me. I had my fist clenched and my arm pulled halfway back before I remembered I wasn't allowed to return the favor. I used to be a CNA working swing and graveyard in nursing homes. One of my more creepy experiences was when I had a lady in my hall that was actively dying. I found that a lot of time when the dementia folks are in the process of actively dying, they babble. It's weird at first but you get used to it. This lady didn't babble. She was completely silent and still and it creeped me the frick out. Other than that, I went along with my usual system of checking on her every half hour to make sure she was clean and somewhat comfortable. On my last check of her before leaving for the night, I had just cleaned her up and I had my back turned as I was emptying up a garage when a hand reached out and grabbed my wrist. I turned around to see this tiny old lady sitting straight up on bed, staring at me, with a death grip on my wrist. She didn't say a word and just laid back down and went to sleep. So I'm not a doctor, but my dad is, and I sometimes go with him to different hospitals that he works at. There's one in particular that stands out, though. This hospital used to basically be a death camp for people that got tuberculosis. They'd send them there for fresh air to heal them and they'd die because there wasn't any real cure. Very many people died this way in the hospital, and the building in general is old and creepy looking. When he sees patients, I hang out with the nurses' PAs, and they often tell me ghost stories. Because of working there, a lot of the staff has gotten into things like Ouija boards, recorders, ghost tours, etc. too. So that's also cool, and I've heard some of their recordings and such. Here are some of the stories I've heard. Until last year, there was an old elevator that was known for sometimes stopping you on either the second or fourth floor before taking you where you actually wanted to go. This wouldn't be a big deal normally, but this hospital is strangely laid out. It's a 4-story building, but only the first and third floors are in operation. The fourth and second floors look like a typical abandoned hospital, complete with broken wheelchairs, outdated medical equipment, and no working lights. My dad has gotten stuck on the abandoned floors several times in the past, and people have claimed to have bad experiences there. Patients who would report seeing the same people in their rooms. One incident involved several patients complaining about a little boy and little girl coming to their rooms at nighttime. Several patients refusing to stay in their room again after the first night. People hearing screams and children's laughter. A horror movie was filmed at the hospital on the third floor, and the staff kept noticing noises that were messing up the filming coming from upstairs. They went downstairs and asked the staff to tell the nurses on the fourth floor to quiet down. No one has worked on the fourth floor in a very long time. CNA in a nursing home. I swear I heard a walker going down the hallway for a full few minutes. Hallways were empty, no doors opened or closed, and we did rounds 15 minutes after hearing that, and every single person was in bed. There was an old woman, in her 70s, when I first saw her in 1985. A chronic schizophrenic by all criteria. The consultant who trained my consultant was a resident in psychiatry as she was admitted the first time, 1943 that is. I found it rather strange that my consultant would never ever prescribe her any medication, instead would treat her as a guest visitor whenever she dropped in to have a chat with her friend. My consultant was due to retire, and during one of his last days, I summoned the courage to ask him about the old woman. She fulfills every requirement that warrants the diagnosis, yet my consultant never ever attempted to admit her or treat her, nor did I. You must never as well. The answer was unexpected. He must have read my complete shock. He took out an old worn-out file from his cabinet and asked me to read. Pages were yellow and the ink was fading, but the dates and notes were legible. 1943. His consultant had broken the rule, secured a patient's file and kept with him. Then he handed that file and the patient to his student, who was incidentally my consultant. As I read, I knew the reason. She had, back in 1943, while in a mental asylum, predicted demise of Nazis, usage of nuclear bombs, and half of Europe falling under atheist communists. Freedom for colonies in Asia and Africa. The notes said that she had systematized delusions and auditory hallucinations that she held to be true and voice of God. I never saw her after my consultant went into retirement. However, if ever there are a few enigmas that I encountered, she is the biggest of them all. I had a 29-year-old woman come in for drug overdose and was on life support for a few days while being brain dead during the same time. The mother eventually chose to withdraw care and the woman died in 30 minutes. The color of her skin had gone an extra tone of white that no movies can match, with her sunken eyes open. Security here. In the Cancer Institute for one of my hospital plazas, you can always feel someone watching you. Or if you're standing in the parking lot, you can watch TVs go on and off. Or if you're extremely unlucky, you can see a figure standing in the window then vanish. I always thought security is one of the worst jobs for dealing with paranormal stuff. You're usually all by yourself. Fresh intern in a massive university hospital. As with a lot of hospitals in the UK, half of it is space aged while the other half hasn't had a lick of paint since the 70s. A lot of the old section of the hospital has been out of use for years, but late at night interns would navigate these closed wards and corridors for shortcuts when under pressure. My cardiac arrest bleep, Yanks call this a code, went off about 3 AM. I was on the ground floor of the old section of hospital and the call was to the far end of the top floor of the same section. I ran up 5 flights of stairs to bring me to the right floor, but the wrong side. I had to pass through a massive abandoned ward that was completely pitch black to get to the ward I wanted. I sprinted down a long dark corridor. Huffing and puffing, I nearly smashed into an elderly lady. She grabbed my arm. I'll never forget how ice cold her grip was. "How do I get out?" she said. I pointed towards where I had just come from and told her to get into the elevators. I continued my sprint. I was the first doctor to make it to the bedside. A nurse was performing CPR and another was drawing up adrenaline. I went to the top of the bed to manage the airway. I looked down. It was the same old lady I met in the corridor. This is my favorite so far. Chills. Former CNA here. I used to work in a rehabilitation center for post-op surgeries. I worked at a small facility, less than 100 patients. In that time I had one peculiar case. I was doing my rounds, answering call lights and helping out where needed. When I got towards the end of my hall, there was an elderly gentleman that had knelt down and died. It was very alarming at first. He had an IV in his arm and an oxygen tank when he passed. At first glance it looked like he had died by getting tangled in his tubes, but after getting the nurse and examining his body on the floor, we determined it was a last burst of energy before he passed. I didn't get to know him, as he was bedridden, but that incident has stayed with me forever. Maybe more disturbing than creepy, but I get called into work late one night. I am an RN working in surgery, and late night calls are always a roll of the dice as to what you might get. The hospital operator calling had very little detail as to what we were coming in for, just the surgeon and patient name. I get there and the doctor had booked a transmetatarsal amputation on a diabetic patient, which is not unusual. When I go to talk to the patient, it turns out that due to his diabetic neuropathy, and therefore lack of sensation in his feet, he had a sore on his toes that had gone and treated again. Not unusual. Well, in this case, he had awoken to crunching noises in the middle of the night. He wakes up and turns on the light to find that underneath the covers, his beloved chihuahua had eaten all 4 of his smaller toes and was working on the great toe. The wound was a pretty ghastly sight, and the sight of those tiny teeth marks is something I'll never forget. If you are new to the channel, you can subscribe. I publish new videos every day. Until then, check another video. Bye for now.